Okay, we started. Hello and welcome. My name is Karishma Patel, and welcome to, I think this is now season 7. I took a really long break, like a few weeks, because I just went 10 weeks straight last week. And now we're starting off really strong. I have a really, really special guest today, so thank you for listening in. Thank you for tuning in. And let's welcome my next guest, Natasha, sorry. Oh my God. I got nervous. When did I get nervous? Natasha Gambhir, welcome to Unscripted.
Thank you. Thank you for having me.
No, thank you so much for being here. I've been trying to get you on the podcast for probably like a year and a half now.
Probably a year, yeah.
But now you finally made it to Austin. Backstory, she's from Dallas, so she's in Austin for the weekend, and she was like, want to hang out? I was like, yes, but also, do you have time to do a podcast? Because I need you to listen to this woman's story. She is so incredible, and she is a badass. Yeah.
Thank you. From another badass. Thank you.
So what brings you here this weekend? Also, for the people tuning in, like, what do you do? And yeah, I want to know more about you, and they want to know more about you.
Yeah. So I used to live in Austin because I did my medical training here. I did my residency here at UT Austin and absolutely loved living here. And then once I got married and finished my residency, I moved to the Dallas area. I did my training in psychiatry. So I'm a psychiatrist by trade. I would call it my daytime job. And absolutely love it, very passionate about it. I'm super specialized under psychiatry in the eating disorder world. So I work with women and men that are struggling with body dysmorphia, anorexia, and bulimia, so the 3 big categories. And I work at Eating Recovery Center in Dallas, where I get to treat not only the medical side of the eating disorders, but also the psychiatric side.
Wow. You know, that's so rare to find Indian people in the psychiatry world. How does that, like, how did you choose to become one?
Yeah, actually, I never thought I'd be a psychiatrist. I feel like a lot of psychiatrists say that, but
That's what my psychiatrist says. He's like, I never thought I was going to be it. But
That's
I was
fair.
like, you're amazing. I feel like this is the perfect job for you.
I feel like once you know, you know.
Yeah.
I thought I was going to be a surgeon for the longest time. Then I was like, maybe I'll do OB and surgery. Parents were like, yeah, my daughter's going to be a surgeon. They were like so excited about it. And then I was like, yeah, I'm not a surgeon. Like 100% not a surgeon. I enjoyed it for what it was. But when I did psychiatry and I saw the impact you can have on someone's life when they're struggling or when they're going through the hardest time of their life, I was like, this is for me. This is 100% for me. I want to be the person that helps them make a comeback.
Yeah.
And I love that idea about psychiatry because people can have amazing comebacks. Even after getting hospitalized or needing medication or needing therapy or going through something really traumatic, you can have your comeback.
Yeah. It's never too late.
It's never too late.
Yeah.
Yeah. In fact, this morning I saw a 73-year-old man, and he's having his comeback right now.
Oh my God. Go him.
You don't know what your next decade's going to bring.
Yeah, you really don't. And I feel like that's a great reminder, as it is Mental Health Awareness Month as well, that you're never alone and you always can have a comeback. You can start from anywhere, and you can start and fail and keep trying and keep getting up.
And there's help.
Yes.
There's help all around you.
Yes.
In different forms. My parents were really surprised. My dad's
I was going to ask you my next
typical
question.
Punjabi guy.
Yeah, I was going to ask you. My next question was, how did they react to you becoming a psychiatrist? Because it's a huge stigma in our South Asian community around mental health and all that.
For like a few years, even after I picked my specialty, my dad was like Pagal ke doctor? And I was
Pagal means crazy.
Crazy. So they're like, are you going to be like a doctor for the crazies? And then he went on this whole thing where he was like, okay, but doesn't that make you crazy? Like, doesn't the doctor get crazy over time treating them? And I'm like, I don't think that's how mental health works.
I don't know why our community has this idea, probably movies, but that psychiatry or like going to therapy is like, you're crazy. That's why you go there, right? It's not about that.
No. In fact, like in the eating disorder world, but also where I see patients privately, I see really high functioning individuals. I see Fortune 500 people, like CEOs, and even they have moments where they need help.
Yeah.
And so it could be a really high functioning person, or it could be someone that's just, they're just going through a rough time.
Yeah. I go to a psychiatrist, and I've been going to him for like 10 years.
And look at you.
Yeah,
we're functioning woman, badass woman over here.
But it's just to say, like, everyone's problems are different, and I feel like everyone can aid from a little bit of therapy. Yeah. So then how did your parents deal with?
So initially it was quite a shock, but they really came around to it.
Okay.
And I think it's a different story now because I think they've seen what I can do for the community.
Okay.
When I initially told them my reasoning was very much centered around the fact that I don't think that South Asians have someone to talk to and don't feel comfortable going to see psychiatrists or therapists because they're not from their community. And I just felt like I never got to see someone when I needed help when I was younger. Yeah. And it would have been great to have seen someone. I kind of went to therapy later on in my life. Yeah. But it would have been great to have...
To start young, yeah.
Exactly. So that was part of my reasoning. And then when I started doing more for our community, especially like our religious center, started helping people out. They found out that I was a psychiatrist, reached out to me. I was able to educate people in my own community. And that, I think, has been the coolest part of my journey. Because it's like the whole reason I did it.
Yeah. And it's so beautiful that it's slowly coming. I wish the progress was more, but it's slowly finally coming around. And I love that. And that's to my next question is, what's one myth about therapy or psychiatry you wish we could erase for good? For me, it would be, you got to be crazy to go to therapy.
That's a good one.
But as a psychiatrist, what do you think?
That meds will make you crazy.
Yeah.
Yeah, I think people think that meds will make you crazy or that I'm going to push meds. Which meds are a last resort. Yeah. And if you need them, you need them. And honestly, I've seen people transform. Well, and then I've seen people not do well on it. I mean, it's not for them. Yeah. But majority of the time, I think the stigma is like it's not holistic or it's not natural. It's unnecessary.
Sometimes people need the extra help. Especially someone who's chronically going through anxiety, panic attacks. Exactly. They need a little bit. Yeah.
And I was on meds for a brief period in my 20s, and I thought that it really helped me through a tough time. Because when I was applying to med school and taking my MCAT, I did go through a bout of depression and anxiety. And the other myth that ties into it is that you need medication for life. Yeah. Which is not the case a lot of the times. A lot of the times you need it for a short period of time, and then you'll do really well without it too. Yeah.
I was fortunate enough that I didn't have to get on any meds, because that's also my doctor. He says that's my last resort.
I love that.
And he was like, you seem like you can do it without it. And obviously, if I ever needed, there would be an extra support. But no, I love that. And then what's the mental health conversation that still feels too taboo in our community?
I think it's really hard to talk about suicide.
Yeah.
I don't know if it's just our community. I feel like suicide in general is still really hard to talk about. There's a myth that if you talk about it, people are more likely to engage in suicide. That's not a true statement at all. The evidence is that that's not the case. In fact, bringing it up or asking someone about it is more likely to prevent it. But I think self-harm, suicide, that whole area is still not touched.
Yeah. I do think like you said, I think when people, when they think they're going to talk about it, they do think they're pushing it.
Perpetuating it.
Yeah. And it's no. It's actually, like you said, it helps people understand that is not your only option.
Exactly. Makes them feel like they're not alone.
Yeah. And that was so dark for me. I had a dark time too when I went through that, and I felt like I couldn't talk to anyone about it. But thankfully, that was the time I also started therapy, and then my therapist really helped me get through it and made me understand that it's okay. we can talk about it. And there's just so much stigma around it. People are just so scared. It's like that word. They're like, oh, suicide. Oh my God, let's not do it. You know, like.
Yeah, it makes something that they have to spring into action.
Yes.
And I get that because it is a safety thing.
Yeah.
But talking about it and coming up with a plan to keep them safe or getting them help is more likely to prevent it than not talking about it at all.
Yeah, I agree. And that's why these conversations are so, so, so important, especially with like your family. And I think that's another thing. How would you tell someone to talk to their parents about like getting help, going to therapy as a psychiatrist? Because I know a lot of people in our community especially struggle with that. For me, I started seeing a therapist in secret. So my parents didn't know until 2 years later. I was like, oh, I've been going to therapy, you know? So that's why I am the way I am
Doing
now.
better.
I'm doing better because of him, you know? So how would you tell people that they can reach out?
So if you want to do it on your own, then I would say make sure that you are able to express what you're actually feeling so that they can understand the need too. Sometimes they just don't understand the need for it. I hear that a lot, especially like in the Indian South Asian community. I hear it like they don't feel like it's gonna do anything or that it's necessary. So make sure you state the reason. So, you know, saying like I'm depressed or I want to see someone might not help them get the full picture. Using words that are more around feeling, like I've been feeling really down. Sometimes I feel really hopeless. Sometimes I feel like I can't function or I can't keep going. So giving more descriptive talk is way better than just saying, hey, I want to go see someone.
And then if someone were to say that, like what if the parents like rebuttal, like, no, you're not feeling that. You're just, it's all internal. Because you know how Indian parents are.
That's literally
they
the
always
response
say
every
like
time.
there's nothing wrong with you. You just need to eat, or you have everything so good.
Yeah,
that was
you
my
have
parents'
everything you
response. You have
need.
everything you need,
And more.
We've given you the life. Why are you sad? Or you know. So how would you tell them to respond to that?
It's really good to acknowledge what they're saying as well. So you can validate their thoughts too. You can be like, you're right. Like you have supported me. You have given me all my resources. You're absolutely right about that. At the same time, I think there are struggles that are different for me than they were for you.
Yeah.
And then, you know, sometimes you might not get the response that you're looking for.
And that's when you just have to.
And that's when you got to do what you got to do.
Yeah, you got to do what you got to do.
If you want to, you know, seek help and you are over the age of 18, you're welcome. People are welcome to seek it out on their own. Telling a friend is helpful, or telling a relative that may understand, that can always be helpful as well. So if it's not like your parents per se, but an older sibling is a great example of someone that might be able to help. So seeking other avenues, or seeking help without their approval.
Yeah.
Sometimes that's the way it has to be.
Yeah.
And then I don't feel like that closes the door though.
Yeah.
I've had a lot of patients that I've seen long term where they have me help. And they ask me to have that conversation and explain it.
So how does that go for you?
I think it's so much better coming from a doctor.
Really?
I really do.
Is it, well, okay, depending. If it's a South Asian patient, do the parents are often, because some parents will deflect and be like, no, this is your fault.
It's true.
You're the bad person.
But I do think that when I give them the full story, and they have someone that has, you know, okay, you know, maybe not with a psychiatrist, but like a physician per se, I'm saying I'm their doctor, it builds some confidence. Yeah. And it gives them some confidence. Or even with a therapist, like I've seen that, like they get the courage to be like, okay, let's reapproach that topic now. Yeah. And then it actually goes really well. Sometimes I feel like they completely change their perspective after I talk to them.
Well, also, you're just, like, super approachable and super kind. And I think it's also your energy. And that was my first question I asked you, I think, when I met you and you were telling me your story. And it was, how do you take care of your own mental health while holding so much space for other people? Because as a psychiatrist, I'm sure you're taking in so much that, how do you emotionally take care of yourself?
So, depends on the intensity of the work I'm doing. Because I would say when there's more going on, especially different seasons, then I try my best to make sure that I'm scheduling breaks from work. I love to travel.
Yes, you do.
I do.
You're crazy.
I absolutely love travel, and my husband does too. So getting away and traveling, whether it's like a local trip or even a staycation like this, or traveling to a different country, that is like helped my burnout significantly. We actually started a tradition when we were interns in residency, so probably over 7-8 years ago, where we would take 2 international trips that we would schedule way ahead of time as breaks from the medicine world. Yeah. And we just get away. And
because he's a doctor too, right?
He's a physician. He's a neurologist. So we'll just schedule it way ahead and have that. That really helps. We've kept up with that. So we've been taking the 2 weeks off and then another 2 weeks off every year.
And no work at all.
No work for those 2 weeks.
I love that.
Completely getting away.
Didn't you just go on a trip with your parents too? You took them? Where did you take them?
I took my parents to Europe for the first time.
That was so sweet. Because, you're seeing your parents live their life for the first time.
They are. Oh, they're living a good life. They're actually in Switzerland right now.
Oh my God. I love that. That's like my parents. They're just like living life. Sorry, I have a hair in my mouth. What the heck? Might be one of my dogs.
I would say like it's all about scheduling ahead of time.
Yeah.
Like working out really helps me, staying active. I think the more you're cognizant of making sure you leave time for yourself, the better I do.
Yeah. Like pouring into you so you can pour into others. Exactly. And that's what I always say to everyone too. And they're like, no, you're crazy. And I'm like, no, like seriously, if you start taking care of yourself a little better, you show up so much better for other people.
Yeah. And when I know you like go work out in the morning.
Yes.
I 100% agree. When you take the morning for yourself, the rest of the day you're able to pour out more.
Yeah. I did a yoga flow this morning, then I had a meeting, and then I have this, and I was like, now I can pour into other people and talk to people and converse, and you did the same. You went to 7 a.m. berries, which I don't think I'll ever get there. I literally had a goal this year when I started. I was like, oh, I'm going to become a 7 a.m.er. It's mid-year. I'm still like a 8 a.m.er. I can't.
Okay, but I will be honest. I'm also like an 8:39 usually. Today was just an exception. I will say I made a vision board this year, and the center of it was to try to wake up at 6.
Wow.
I haven't gotten there yet.
I haven't gotten there either.
But it's still early in the year.
Like, why do we have to make these crazy goals for ourselves?
I want me time in the morning.
Yeah, I want me time too. But you have a corporate job, so I get it. Like, you have to wake up before your job and try to get it done before you.
But I go in at 10, so I have a lot of time.
Okay, so. That's nice. You have a chill morning ahead of you before, like...
That's where the self-care comes. It's the mornings.
How many patients do you see a day?
At my traditional day-to-day hospital, I see around 15 to 17 patients. And then if I'm working at any other hospital, like an acute psychiatric hospital or a clinic, then I might see 10 more there. But not always.
Yeah. And then... what's something small like that can make a huge difference in someone's mental health?
I feel like just surrounding themselves with the right people.
Yeah.
I do think, there's a lot of talk now about removing people from your life. There's a lot of like,
how do you feel about that?
There's a group of people that are like, no, you shouldn't give up on your people, especially been friends with them for years, decades.
I'm in the same boat about, no, not that part, but I'm in a situation right now with that. So I would love to hear your thoughts on...
I'm on the other side. I think that if someone is... I don't want to use the word adding because I feel like that's a very like selfish way to look at it. But like if someone is not allowing you to be yourself and is really bringing you down...
I don't think they deserve to be in your life.
Exactly. And I'm more of that mindset.
Well, also because it's real. Why would you keep stringing a thing along if every time you're hanging out with someone you leave drained?
Drained, right?
What's the point of living like that?
Yeah, and I think the reasoning is like, you've built over time, and you're not supposed to give up on people. And I think they have their own perspective. But for me, I'm like, I don't have energy to do that anymore. And as I get older, I'm more and more on that side.
Yeah.
around the time of my wedding, actually cut out 3 of my friends.
Wow.
That I've been friends for over a decade. And so now looking back, I'm like, that was 100% the right decision.
Yeah.
But in that moment,
You feel so like hurt, or what am I doing?
so painful.
You know, I think that's so important, because the older you do get, you also realize who makes you a priority as well, and who you make a priority. I make a priority to the people I care about, but if you're pouring into me, I'm definitely going to pour into you. But if you're treating me like you're texting me 10 days later after one text, or like, and then I text back immediately, because I'm a person who texts back immediately, like within a day. I'm not someone who'll, because I know how it feels to be ignored, so I'll never do that to someone else. But when other people take like 10 to 15 days to respond, it's like, what were we even talking about? Why?
I don't know what we're talking about.
How are you that busy that you can't respond to someone? I don't get that.
It's a quick text, yeah.
But that's also a priority thing, right? So I'm not a priority to you, and that's fine. I just didn't know that that's where we're at. You know?
That's fair.
So,
Yeah, it's about matching
Yeah.
the effort. And so I would say, you know, if you do feel like you have people in your life that bring you down, that judge you, or don't, you know, or you've changed and they don't understand the person that you've become, but you love the person that you become,
yeah.
then that would be something that you need to create distance with.
Yeah.
I feel like that makes a big, big difference.
Oh, for sure.
People think like the people that you surround yourself with is a small part of your day, because most of the time you're working,
Yeah.
eating, sleeping, right? But that energy, it collects over time. And I'm like, gotta preserve my energy.
No, for real. And that's why you're like always glowing, because you literally preserve it all, and you spend it wisely. And I think that's the important part, especially the older you get. You know, you were talking about you specialize in eating disorders and body dysformias. What is a misconception people have about eating disorders? Because I feel like there's so many.
There's so many. The biggest one I hear is that it's all young people, like it's just teens. But I actually see people in their late 20s, 30s. I even have people in their 50s there.
Yeah.
So I think people think it's like young women. I see men, I see older women.
Yeah, it's
really,
not like just gender based.
and people think of an eating disorder as anorexia.
Yeah.
But there's so much more to it.
There's different types too, right?
Yeah, there's people that stop eating for completely unconnected things as well. Like stress. Some
Yeah.
people have like a traumatic choking experience and they now fear eating, especially kids.
Yeah.
So it's all working around fear. And then sometimes it is, you know, solely body image. They see the current social,
Yes.
what we applaud, I guess, socially. And so that pressure. And, you know, for that particular type of patient, I do see a lot of people that are still in their impressionable ages.
Yeah.
So their mind is not fully developed.
Yeah.
And their social media, and they may or may not have some trauma or were bullied in some way. And all of that collectively creates this awful, awful illness that people die from.
Yeah. Man, that's a lot. And, you know, with the social media world too, like body image issues are a huge thing. I personally have dealt with some too, being on social media for so many years. But then I got to a place where I'm like, you know, I love me for who I am. So for someone going through body image issues, especially because of social media, how would you tell them how to tackle that?
So a lot of the times we have them take a break from it.
Okay.
And we try to gear them towards more body positive accounts and, you know, focus on switching the narrative to, okay, first, what's going on? Are you even eating? Is your brain even functioning? Are you even sleeping? So fixing those things and then going deeper into loving yourself versus trying to reach this very particular body type.
Yeah.
Because that's usually what's in their mind.
Yeah.
They are chasing a very particular look, which is not possible for everyone.
No, like we have so many different body types.
And there's so many other things at play, like genetics, heritage, all of that kind of stuff that are at play. And when they're at that age when their mind isn't fully developed and they're 16, 17, 18, their ability to look past all that and be like, well, I love myself for who I am, it's not there like how we have come to that.
Yeah. I mean, they're young, and social media is like a core part of their life right now.
Exactly.
So I get that. Well, what was I was going to ask you something along that lines, but I got so deep in my own thoughts about this because I've gone through this, but with body images, I found my train of thought. It was about loving yourself because you said loving yourself. How would you help someone practice self-love on the daily?
Yeah, that's a really good question, because I think even us as clinicians, whether we're psychiatrists, therapists, and I work with dietitians as well, so we're a very collaborative, multidisciplinary team for these patients, because they need a lot.
Yeah.
They're very sick. They're sick medically. Their brain's not working, and they need food. So all together, even all of us sometimes struggle with how to help them see what we're seeing.
Yeah.
Because they don't have the same opinion that of themselves that we can clearly see.
Yeah.
So I think we still struggle with that question, is how can we get people to see it? A lot of the times I would say it's continued therapy, time, and getting family involved. Every time we get their loved ones involved, we're able to help them see more and more.
And like friends
And support system. Support system makes the biggest impact in creating self-love, because then they have something to, it's okay to have external motivation first and then have internal, but support gives them something. Like, okay, at least I'll do it for them for now.
Yeah.
Eventually, over time, they start doing it for themselves.
Yeah. Loving yourself is a lot of work, too.
It's not something you can teach. That's the funny part.
It's little things, like acts of self-love. Like what we talked about is a good morning routine, like going to go work out for you. Like movement plays a direct role in my mental health.
Same.
For me. I know a lot of people have different things that work for them, but for me, movement is that thing for me. So I feel like when you make more time for things that make you happy, like little things, like just some cup of coffee in the morning, or like just 5 minutes to yourself in the morning, journaling. It could be the simplest things. I think that is doing acts of self-love.
It is. And I hope that, like, people who are going through a hard time with self-love can see it that way.
Yeah.
I just think you're right. It takes a really long time, especially if you're also going through depression, which a lot of them are, because then they're stuck in that mindset of not being able to see anything brightly. And that's where, like, my role comes in, where, like, okay, if you're at that point, maybe we could try meds. Maybe we can try a different kind of therapy and eventually get them to have some self-love. We also do, like, a lot of other therapeutic things. Like, we do self-love journaling. We do, like, writing self-love on mirrors. We do these mirror exposures where you stand in front of a mirror and talk about what you love about yourself.
Oh my God, if you make me do that, I'm going to get so shy.
Okay, everybody gets really shy. I did it too. And even I was like, and even though I've taught the mirror thing, I was like, okay, let me take a deep breath first.
Yeah.
But you get in front of everyone and you just get in front of a mirror and you do it. And it's overwhelming, but at the end of it, like, you know, everyone kind of celebrates that.
I try to do that, but every time I do it, I get shy, even if I'm by myself. But one thing that's really helped me see my true self is I have 2 pictures on each of my mirrors on my vanity. It's of me from my younger self, this little girl, little baby version of me, but like at 4 to 5 years old, but smiling. I don't remember these pictures. One of them is at Disneyland and one of them is like on a boat. But I was so happy, and every time I see that picture, I'm just like, why would I say anything bad to this little girl? Like, this little girl doesn't deserve that. And so that has made my self-talk so much better. And I feel like if people can do that, if you find a little baby picture of you and you want to put that on your mirror, that is one thing that has helped me so much for the past, I think, 2 years now.
I love this. I actually will try that with one of my patients.
Yeah.
Who needs it?
It's very helpful, because you really look at that younger version of you that's so happy, and you're like, why would I
and
say
so
something
sweet
bad?
and so innocent, and you look back and you're like, you know, it's interesting, even with having worked with people who don't have any self-love and they're working towards it, even day to day, I will hear people who have a lot of self-love, including myself, make comments that are negative towards themselves.
Really?
So
yeah, me too.
You have to be mindful of it. Because my husband, he catches me on those.
He's like, mine too. He's like, girl, you're being really negative. I was like, you know what? I'm in my luteal phase right now. Also, I think that's another thing. I think there is a misconception of, yes, we preach self-love, so that doesn't mean we're positive all the time. That means that we choose to see more of the good than the bad. Because it's just like the days too that we have. We have a lot of good days, we have some bad days, but in those bad days we try to see the good in that bad day. And I think that's what self-love is too. Like, we're gonna have good self-love days and we're gonna have really bad self-love days, but on those bad self days you just tell yourself, that's okay, I'm feeling this way. Don't push those negative thoughts out. I say, like, feel it out, feel through it, and just be like, okay, that's fine, you're trying to protect myself, but I'm gonna push through it. We're gonna show up tomorrow even better.
I really like that. The core is still self-love, but you can ebb and flow with the days.
Yeah. Because you're gonna have negative thoughts. We're humans. There's
no way to not have them.
Yes. Yeah. And there's so much shit happening in our world around us and in our day to day. I feel like there's always gonna be a little bit in there sprinkled in. So
that's very true.
Yeah. So if you have a negative thought, that's okay.
Yeah, I was going through a period of very negative thoughts about myself when I had a huge acne flare in 2024.
Oh my God, girl, I've been through it, yes.
And I was like, it was like 2 to 3 months where constantly that's what I was like hyper focused on and just feeling like so not myself and so unbeautiful. And I kept like telling my husband that, and he was like, stop. It's gonna get better. You just gotta stay like full of hope. And in those months, I did have a lot of negative self-talk, but to my core, I still tried to give myself a lot of self-love. Yeah. And surrounded myself with people that still kept me going. And then when I was past it, I was like, whew, got through the hard part.
It's really hard though. Your skin is a direct reflection, right? Because you're seeing your face every day. I've been through it. I went through a super bad acne flare with pigmentation all over, and it's so finally hard. 3 years later, actually 4 years later, it's finally getting a little better. Not want to jinx it, but
we're not jinxing it.
But skin, it's really hard when you see yourself every day, and then you have to show up for yourself and show up for others because you're showing up for your patients every day too, right? So it's like, that was probably so difficult for you. And how did you balance that when you're having negative thoughts, but then you're telling your patients, don't have those negative thoughts, you know? Like, how did you?
That was so hard because it was almost like 3 to 4 months where I was like so down on myself. Yeah. Not even over something I could control really. And still trying my best to encourage, other people. I think it taught me though that kind of what you were talking about, like you can still love yourself and be down for periods of time and then have a comeback. Yeah. You can have periods of chunks of like time where you are a little hard on yourself and you can't help it because that's how you're feeling. You let yourself feel it. But then surround yourself with people that lift you up, do things that bring joy, and then you make your comeback.
Yeah, because toxic positivity is also a huge thing. Like, like we were talking about earlier, not everything is good all the fucking time. It can't
be. No. There are people that are very toxic positive, and I always have to be like, deep breath.
Yeah, that's not reality. Reality is that there is good and bad, and you just try to find the good in the bad situations. That's how I see life, at least. I don't know if everyone else does. I was going to ask you a next question. I forgot what it was. Oh my God, I'm having a lot of blank thoughts today.
Okay,
oh, sorry, go on.
I was gonna say, side note, your ring is like popping right now.
I keep seeing you looking at my hand. I'm like, wait, is there something on my fingers?
It's just, wow.
Thank you, Shay.
He did good. He did real good.
He better. Do you think the South Asian community is more open now in the mental health?
I do think so. I think there is a shift. I think there's work left.
Yes, I think there's still a lot. But I do think conversations are more open now.
I do.
At least in my household.
Yeah, same with our household. I think like I think about when, our generation will be parents and
Yeah.
how we'll do things a little bit differently, and that gives me a lot of hope.
Yes. Like talking about your feelings, not shoving them down.
Like, because I have a little nephew, and, like, I do that with my little nephew, and I think it makes a huge difference.
It does. I had these nieces stay with me for like 4 or 5 days, and the way they just like, they're so smart, and then they're also like so in tune with how they're feeling, and they'll just say it, and it's not like they're trying to be mean or anything. They'll just say how they feel, And I'm like, why couldn't we be like this? They have so much courage and strength to just be themselves, and I love that. It's this next generation.
That's so good.
Yeah.
I don't think I had that.
I
I
did
don't think
not
I
have
could
that.
say that I was anxious without feeling shame. That I was anxious.
Shame. Safe.
I feel like maybe now I could. Maybe if I was like feeling really anxious or nervous, I could maybe vocalize it, but
Yeah.
probably not at a younger age.
Yeah, it was
Yeah.
very hard because at that time it was so taboo to talk about your feelings. So now when I see this next generation in my own family, I'm like, wow, you guys are fucking amazing. I love that. How do you think we can make healing feel more accessible and less intimidating to first-gen kids?
Good question. I've actually never thought about that. I always think about education as a way
Yeah.
to make it more accessible, but if I had to really make an impact in terms of like getting them to open up, I think it's just by modeling it.
Yeah.
Yeah, if you model it, then maybe they'll see that it's healing is possible and accessible.
Yeah.
Like if I talk about the fact that I was on meds for a period of my time. Oh, hey, I did go to therapy.
They would be like, oh, okay, therapy's okay.
Yeah,
I
so-
can do that too.
I think that would be the
Yeah.
thing that I would think would be the first thing. But I also feel like giving education would be really, really good.
Yeah, I agree too. What's one cultural norm that you personally had to unlearn for your own mental health?
These questions are getting tough. Cultural norm.
Mine was, if it helps, mine was people pleasing. Yeah, that was like the hardest thing for me to unlearn, and feeling guilty, like having no guilt when doing things for me.
Good one.
Yeah, those
Yeah,
are-
I do feel like it's hard to have that level of like, I'm doing this for me, which is because everything should be for the community
Yeah,
per se, per the culture.
yeah,
Yeah. It's unique, but I think part of me wanted to do everything that my community would want me to do. I was a really good kid, always followed the rules, did really well in school. I was a classical dancer. I like followed all the traditional footsteps of what a good South Asian woman would do.
yeah.
Went to medical, like did really well at college, went to medical
I
school,
love that. I was a complete opposite.
The honesty, I love it. But I think something shifted around the age of, I would say right around graduating medical school. I became a doctor at 25. I think something shifted where I no longer wanted to be that model
Yeah,
daughter of a South Asian family, and I was like, I'm gonna do whatever I want,
yeah.
and I'm just gonna do it, and it might not get the, oh, you're such a good beta, like,
But
beta, you're
it's gonna
perfect.
get you what you want.
And I think all of it changed then.
Yeah.
I was like, I'm gonna be a psychiatrist.
I love that.
I'm gonna be a psychiatrist. I'm gonna, I fell in love with a Pakistani Muslim guy. My parents were very supportive, so
I
that's good.
love
But
that.
like traditionally, not
Yeah,
what
you just were like,
I was
in
like,
my
I'm gonna
rebel
do
stage
it.
now.
My family in India was like, are you sure that's okay? I'm like, yeah, it's totally fine. Did that, was like, I'm gonna do social media. I'm gonna do some modeling. I'm gonna do some acting. Like, I just kind of just let go and did whatever the heck I wanted.
Yeah, and that's it brought you to here, and it shows.
It brought me a lot of joy.
I love that. And also, when you start doing things for yourself, I feel like you also bring bring in that around you too. Like as soon as you're happy, the people you love and the people that love you are going to be happy for you regardless, because they just see it. They're like, oh, you are actually killing it with what you're doing. And so I guess we love you still. We're proud of you, you know?
I guess so.
I guess so. This seems like a good thing for you. Well, let's go into fashion now, because that's how I met you, through Instagram. Actually, I can't even remember the first time we met. Was it New York?
We met in New York.
That was our first time meeting?
Yeah. What a fun way to meet, too.
Yeah.
I just saw you walking across, and I was like, I think I know her.
That was crazy, because we've known each other on social media.
Way longer before that, yeah.
Yes, but then in New York, we met randomly, and then we just had a really boozy brunch, which was so fun.
So fun.
And then, and then we've hung out like a couple times after.
Yeah. What was that place called? Purple something.
Mr. Purple.
Mr. Purple.
Mr. Purple in NYC. If you haven't been, it's such a fun spot.
And you might meet someone that you become friends with in
Yeah.
real life.
Yeah. There you go. Well, what first sparked your love for fashion? So if you don't know, she has an Instagram. Is it Dr.
Psych and Styles?
Dr. Psych and Styles. And I love it. It's so you. It's so embodying you and your body, your love for fashion. So what sparked your joy for it?
I always loved to dress up, whether it was like brown clothes or American clothes. Like, I always loved to dress up, and I love the idea of getting yourself dressed up for the day.
Yeah.
I really do think it makes an impact on how confident you are, what mood you're in, all of that. So my initial love for it came because I was a whole different person when I was well-dressed. When I felt confident and I was able to put an outfit together, I was like, I can do anything.
Yeah.
It's just this instant boost of serotonin, dopamine, and you're like, I can do it.
No, you're right. I only dressed up today because of you, because I knew you were going to dress up.
And I dressed up for you. So. And I got dressed at Barry's, so I was like.
I love that. Well, have you ever used, you said it's an instant serotonin boost, so is that like a form of self-love for you?
It is 100% a form of self-love. Mornings, like you said, a cup of coffee, a little bit of journaling, getting ready, maybe some movement. I think all of that combined to self-love. But I think anyone that hasn't tried dressing for confidence or dressing for like a mood should totally try it, because it can change the game.
It really can. Like when I'm feeling really down, I'll just put on like a little bit of makeup and a lounge wear, and I still feel so cute. I just instant confidence boost. I'm like, oh, okay. This works. This feels good.
A little bit of mascara and lip gloss,
that's all you need. Or a cute outfit.
A cute outfit. Even if it was a cute workout outfit or a cute lounge.
Or put your hair back in a slick back if your hair looks crazy.
Or if you have oil in your hair.
Yeah.
Which I do a lot.
Me too.
I really, I think that's where it started. And then it kind of grew when I obviously didn't come from a lot of money, couldn't really buy like all the clothes or accessories I wanted. But once I started making my own money, I ventured out a little bit into, hey, what more can I do? And I always still felt like, I don't know if I can spend money on fashion. And that actually was like the best thing for me, that I came from a place where I couldn't buy everything, because it led me to think of fashion in a very cyclical manner. I think what goes around comes around in fashion, and I try to be as sustainable as I can. Yeah. So I buy pre-loved luxury products. All my designer bags are pre-loved.
Love it.
I rent all my clothes. In fact, this is from Rent the Runway.
Oh.
It's a spring dress. So I rent majority of my clothes, probably other than like workout clothes, because that'd be gross. But
that would be gross.
Yeah. And then like it's just allowed me to be sustainable, be more mindful of what I'm spending on fashion, and still like explore and have fun with it.
Yeah. I mean, it shows. You love it.
Thank you.
You're always glowing when your outfits are so wild sometimes, and I just love it, because I'm like, if anyone can do it, it's you.
I like the older I get, the more I'm like, I want to be wild with them.
As you should. I feel like your confidence also grows with the older you get, so you're more comfortable in your skin, so you want to try new things and just have fun with it, because
What's
the point of life if you're not having fun, right?
Yeah, it is so fun. I went to Korea recently, and the fashion there is like so unique.
So good.
So good. And even like their professional wear is so unique. The way they wear very simple colors, but they make them look so fashionable.
Yes.
And I brought back a few things that are like their staples, and I've been incorporating them, and I'm like, it's just so much fun.
I need you to do a video of everything you got from there, so then you can.
I got a lot of skincare too.
Oh yes, Korean skincare. Amazing. I want to go to Korea, explore the culture, explore the foods, everything, and I also want to do a full day of them just stabbing my face and making it glowy.
They made mine very glowy.
I bet.
It did take 6 hours though.
But that's okay. I'll spend a full day if I have to. Like
it was literally a full. It was literally.
Yeah. What's your go-to outfit when you want to feel unstoppable?
A dress.
Okay.
A dress and heels.
I like that. I'm such a pants girl. I'm trying to get more into dresses. This is my year of getting more into dresses. So slowly getting there.
I feel like I need to do the opposite.
Yeah.
Yeah.
You're more.
Maybe I'll get all your pants recommendations.
How do you balance being both a doctor and a fashion creator? Like, how do you do it all?
Sometimes I don't.
Yeah. Have the two worlds collided?
Yeah, somewhat. I feel like I'm a confident person. I think of myself as a confident person, but I'm actually not that confident on social media. I have a lot of insecurities when I post, and I think that has been a big barrier for me. But the thing is, like, the more I like push myself in that direction, the more I'm able to incorporate both. But I do feel it's a lot of like tugging.
Yeah.
I feel really confident in my personal life and in my like physician life, but in the social media life, I do feel a lot of insecurity. And
How do
so
you push past through that?
I think it's just getting yourself to do it.
Yeah.
Yeah. I also try to have like accountability. So people who are also, in the creative space, also posting also on social media, like I really use them to help motivate me and help, I've had people who were mentors in the business. I have someone helping me right now. Her name is Pallavi. She helps kind of guide me and helps me get the confidence to post and helps me like schedule things. Yeah. But I have to say, like, out of all the aspects of my life like that, this is probably where I struggled the most. Like this question that you asked, I still don't think I've figured it out fully.
That's okay. And I feel like we'll never figure it out. But on the posting thing, I'll tell you, it doesn't show that you feel insecure. I see it, you are so confident online. That's what I see as an outsider. But that also goes to show, like, if anyone listening feels this way, that sometimes you just have to post it and then ghost it. Like, that's what I say.
Yeah,
that's post it, then don't look at it. And it can do really well. And people won't know what you're feeling. It's all about what you're showing.
And you have to push through it. If you want to do something, you gotta push through it.
Yeah. And everyone has insecurities. That's another thing. Like,
absolutely.
Sometimes I'll post something, I'm like, ew, I didn't look good, but whatever. I'm not always gonna look my finest. It's because Instagram is a highlight reel, and I don't want it to be a highlight reel. I want it to be also real.
Yeah, because there's not enough people that feel that way.
Yeah, and I'm sure you see that in the day-to-day, especially with your patients. They're seeing that, so it's...
But I wanted to be honest. Like, I do really struggle with it. Like, people who are close to me know that. And
if you ever feel anything, you can text me, and I'll help you through it.
I will.
I got you. Yeah. Well, before we end... No, sorry. I have a question, then we have a rapid fire. So what advice would you give someone who wants to explore fashion, but they're like, it's not for them?
Yeah. Actually, it's funny because someone else just asked me this question. And my answer is always to ask someone who knows about fashion. Yeah. And get their opinion on it. Mm-hmm. Like, be like, hey, will you come with me to try this? Or will you come with me to this store? For me, that definitely happened because I didn't know anything about thrifting or anything about like going to places that were like, you just kind of go and search. Mm-hmm. So I have a friend, I was like, take me and teach me how to thrift. And I don't know how to pair any of this or how any of this works. Yeah. And then I learned. So if you're like, I want to explore fashion, ask a friend
That knows.
that knows, and then have them go with you.
Yeah. That's actually, it ends up being so fun,
It's
too.
so fun.
It's
Yes.
so fun. No, that's a good one. Okay, now we do rapid fire.
Okay, this is my favorite part of your podcast.
Oh, the
Yes.
rapid fire?
Oh yes, yes. I have to sit up for this. It's my favorite part.
It's not going to be crazy, I promise. Okay, first question. Heels or sneakers?
Heels.
Best fashion era ever?
90s.
Oh, yes. 90s. Who was your fashion inspo in the 90s?
Oh, 100% Pooh. And for those of y'all that don't know who that is,
Gubby
she's
Gubby
like an
Gum.
icon. Kareena Kapoor, she was in one of our movies growing up where she was literal fashion icon, like classic 90s
and all her lines in
outfits.
that movie were epic. Yeah. Like, she was all confidence. And those outfits are now coming back, which is insane.
Fashion cyclic.
I love it. And like you said, what goes around does come back around. Your style in 3 words.
Playful, colorful, and elegant.
I love this. I think you already answered this, but I'm going to ask just for the rapid fire. One outfit that instantly boosts your mood.
I definitely think if it's work related and I want to boost, a suit.
Okay.
A suit will go such a long way with me. Like any paired colored suit, absolutely love it. I will wear it to all the conferences, to any meetings. Love them. You can make them fun. They don't have to be black on black, I promise.
Yeah.
And then a dress.
Yeah, a dress. That's what I was thinking. Journaling or meditation?
Journaling, 100%.
You don't like meditation?
I don't. I think it's for some people. It's just not for me.
Yeah.
I get more anxious.
Really?
Yeah.
Okay, we'll get into that. Mental health buzzword you're kind of over.
Oh, tough one.
That's okay. Take your time.
Yeah, I don't
It's
know.
not a rapid fire or anything. I'm totally kidding.
Bipolar.
Okay.
Yeah, people use bipolar in common terms. Like they're like, oh, the weather is so bipolar, or I feel so bipolar. That's not really what bipolar is. It's totally different when you have like mania and depression, and it lasts for several days. Not people say like they're bipolar. They think that they're talking about they're moody or they're dysregulated. It's totally different.
Totally different.
And so I do think that there's like this weird phrase that people use, like, oh, I feel so bipolar. I'm like, that's not bipolar.
Yeah, let's stop using that word.
Yeah.
And then lastly, what's one thing therapy taught you that changed your life, that you can help others?
I think the number one thing that therapy taught me is that you can have everything in life. You can be the most blessed individual, and you can still be anxious, you can still feel down, and you don't have to feel guilty about it. A lot of the times when I was like, I don't think I should go to therapy, it's because I felt like my parents gave me everything, and I didn't have anything to complain about, and I shouldn't complain, but I still felt anxious. I was like, how do I reconcile that? But you could have everything.
Yeah.
And you can still feel anxious. Like, it's okay.
Yeah, it's completely okay.
Totally fine.
It's
Don't
totally
compare yourself to other. Don't be like, okay, because that person doesn't have money, that person is sick, only they can have anxiety or depression.
Also, money can't buy happiness. It's
very true.
You can have, like you said, you can have everything, but you can still feel lonely, sad, depressed, anxious, and it is completely normal and okay. No, I really like that you said that, because I feel like we don't normalize these conversations enough. So, yeah. Well, thank you for being here.
Thank you for having me.
Thank you for taking the time out of your really crazy busy day and making time for me and our audience. I love you so much.
You too. Thank you for having me.
And thank you guys for listening in. I hope you tune in every week on Tuesdays. And go take care of yourself today. Do something that makes you happy. And yeah, love you so much.